Now, the Ministry of Health, the Cancer Association of Namibia, and various stakeholders are converging for a two-day meeting to discuss the National Cancer Control Plan, coinciding with the National Cancer Awareness Week from August the 5th to the 9th, 2024. Now, this initiative aims to address the pressing cancer crisis in the country by enhancing cancer care and reducing mortality rates. The meeting serves as a platform to integrate patient perspectives and stakeholder insights into a comprehensive strategy for effective cancer control. Mr. Ben Nangombe, the Executive Director in the Ministry of Health and Social Services, is now joining us for this conversation and more. A very good evening to Mr. Nangombe. Thank you for being here this evening.
Thank you very much for inviting me. How are you this evening?
I'm very well, thank you, and I'm so happy to host you this evening.
Wonderful, I'm glad to be back.
Great, welcome back. So, talk to us about the primary objectives of the National Cancer Control Plan that is being discussed during this very important meeting.
Yeah, the meeting was basically convened in order to give greater impetus to the development and finalization of the National Cancer Control Plan. The ministry, as far back as 2015, actually started with the draft of the National Cancer Control Plan. That draft was revised in 2019, but of course the events of COVID interrupted what we intended to do. So now that COVID is behind us, we are going back to look at the draft National Cancer Control Plan together with our stakeholders with the aim of, as I said, just giving impetus to it, engaging with the stakeholders so that we can revive this plan, take it forward with the view to make it that tool that is going to guide our actions, is going to guide our plans going forward in dealing with the scourge of cancer in our country, because we need to have a proper costed, consulted strategy that is going to take us forward in this regard.
So how does the integration of patient perspectives influence the development of this policy or this plan?
You see, when you talk about cancer or any disease, you are talking about individuals who are affected by that particular disease.
Right.
So what we are doing with the involvement of people who are affected, the cancer patients, the cancer survivors, is for us to get the views of people with what we call lived experiences. So these are individuals who have been affected at a personal level by this disease. These are survivors who know how it feels to encounter and live with cancer. So involving them basically means we are going to get first-hand information about how it feels, what is it that we need to do, what is the best way to put mechanisms in place that address the needs of people that are affected by cancer, how to deal with their relatives, for example, what facilities we need to to put in place, and how these facilities should look like. So we want to have the voice of the people who have lived with cancer. As they say, nothing about us without us. We want to make the survivors of cancer part and parcel of the planning process so that that can inform us as policymakers to do what is right.
Right. So, of course, the Cancer Association of Namibia is one of the stakeholders. Now, what is their role in shaping the national cancer policy?
The development of the National Cancer Control Plan is a multi-sectoral endeavor. We are engaging various partners and stakeholders, whether it is our development cooperation partners such as the WHO or the Africa CDC or the private sector or non-governmental organizations and welfare organizations such as the National Cancer Association. So the National Cancer Association is a welfare organization that is registered with the Ministry of Health and Social Services. It's an organization that was established actually many years ago. I think in 1978, if I remember correctly. By that time, of course, Namibia was not independent, but cancer was still with us. And after independence, it was then transformed into the Namibia Cancer Association. It's one of the stakeholders that we engage on a regular basis on issues related to cancer. They provide advocacy services. They have even opened facilities that offer palliative care, etc. So they have a fairly extensive knowledge about dealing with issues of cancer. That is why they are part and parcel of the stakeholders that we are engaging. So as a partner organization, their involvement in this endeavor is quite critical.
Talk to us about some specific challenges that the country is facing right now in cancer care that this plan, hopes to address.
You see, it is said that prevention is better than cure, right? And there are ways and means in which we as Namibians, we as members of communities can conduct ourselves and prevent the onset of cancer in individuals. That means, for example, foregoing the use of certain substances. We know that, for example, smoking can lead to various forms of cancer. The use of other substances can also lead to that. So the one thing I think is a challenge that we can point to is the issue of whether we have sufficient awareness amongst members of the communities to live in a manner that prevents the onset of cancer in individuals. So education, public awareness is one of the main challenges, and that is what we need also to address through the development of this plan that we are embarking upon. The other issue is, you will never have sufficient equipment. So diagnostic equipment, for example, may not necessarily be sufficient for us to do what we need to do, particularly given the fact that the more than 85% of the Namibian population depends on public healthcare services. So we don't have sufficient equipment in the public sector to cater for the needs of our people. So for that reason, government ends up referring the patients to the private sector, spending substantial amounts of money in that regard. So that is one challenge of equipment, of facilities, etc., etc. So we do need to do more. And in fact, that is why government is in the process, for example, of updating our radiotherapy equipment at the Bernard May Cancer Center Central Hospital. We have a Cobalt 60 unit there that is used for radiotherapy. I'm glad to say that the radiation source for that equipment, which we have been waiting for, which was ordered from overseas, arrived this month, and we are moving forward to get it installed. So it's some of these challenges, but really the question of space, for people who are affected, the question of palliative care as well, because you find that in many instances, a person becomes bedridden and they just need that palliative care. It's a question of awareness among communities. How do we deal with the people who are affected by cancer so that there isn't there's no stigma at all, that we address the question of stigma, that the people who are affected by cancer can actually live productive lives. And that is also the message that we need to put forth.
Right. So in conclusion, Mr. Nangombe, what steps will be taken following this meeting to ensure that the implementation of this plan, discusses the strategies?
Yeah, as I said in my opening statement, what we need to do is to inject greater impetus into the National Cancer Control Plan. So the fact that we have brought together stakeholders speaks to our seriousness about this matter. So going forward, what we are going to do, we are going to ensure that there is consistency in terms of engaging with the subject matters that we are dealing with. So we put in place working groups that are going to meet on a regular basis. We are going to ensure that there is follow-ups on the assignment given to the various discussion groups, and to make sure that we actually, as I said, revitalize the development of this plan, so that at the end of the day, we have a plan that is comprehensive, that has got broad ownership of all stakeholders, and that is implementable, that has got a proper monitoring and evaluation framework to ensure that at the end of the day, when we actually finalize and launch this plan, it's going to help guide the national response to the issues of cancer control. And I just want to add that the ministry has actually prioritized cancer is one of those diseases that we need to deal with in this country, and is part and parcel of the National Strategic Plan for Non-Communicable Diseases that was launched by the Honorable Prime Minister in 2019.
Thank you so much, Mr. Nangombe, for coming to share this information with us. All the best.
Thank you very much.
That, of course, has been the Executive Director in the Ministry of Health and Social Services, Ben Nangombe. He has been speaking to us about the National Cancer Control Plan, which is coinciding with the National Cancer Awareness Week, which started from the 5th to the 9th of August. The Daily Roundup will continue just after this short break. Do stay with us.